Welcome back to the Morning Blend. According to the U.S. Department of Health and Human Services, 1 in 4 women dies from heart disease. Do you know the signs and symptoms? 2 groups in particular face the most risk. Here with more is Director of Interventional Cardiology, Dr. Kwarteng with Well Health Cardiology. Good morning and welcome to you.
Good morning and thank you for having me.
Well, doctor, as you know, a staggering percentage of Americans suffer from heart disease, but as I just mentioned, 2 groups in particular face heart disease as their #1 killer. Can you explain this?
Yes, to get to that point, it's important for people to know that heart disease and stroke do affect a very large segment of our population. As a matter of fact, heart disease as a disease entity affects over 750,000 people every year.
Wow.
And about 370,000 out of those who die from heart disease. Stroke is the 4th leading cause of death in Americans, and it affects women as well as men. But importantly, African American women as well as women in general get disproportionately affected. African American women are twice as likely to have a stroke or heart disease and more likely to die from their stroke or heart disease.
Now, why is that the case? What does the research show?
Well, the reason why that is because there are things called risk factors. In other words, disease entities that predispose people to developing heart disease. These include high cholesterol, high blood pressure, being obese or overweight, having diabetes, smoking. All of these are risk factors. There are also family factors. In other words, people with family members having heart disease. Now, the reason it is higher in African Americans is because they are more likely to have these risk factors and less likely to have it under control.
And I just saw the list on the screen there.
Absolutely.
We popped that up.
That's
and
right.
Those are the risk factors that
Correct.
people can control.
That's right.
So what can we do to lower our risk given that list? Some simple things.
Well, very simple things. Let me break it down a little bit.
Yeah.
When we talk about heart disease, people have the misconception that heart disease is, coronary disease. It is the coronary disease part, which is the cholesterol plaque buildup in the blood vessels that affect the heart muscle itself, is the most common form of heart disease. And to develop these cholesterol plaque buildup, or what we call atherosclerosis, the cholesterol, high cholesterol, the high blood pressure, the diabetes predispose you to these development of the disease. And so if you can modify your diet and control your risk factors, in African Americans, 1 in every 3 African Americans will have hypertension or high blood pressure. So being able to control these risk factors will go a long way in reducing your risk. As a matter of fact, stroke and heart disease, about 85% of those are preventable if we can change our lifestyle and the way we go about our lives. Now, what I tell my patients is that when you go grocery shopping, stay on the walls.
Okay.
Now, what do you find when you go grocery shopping on the walls?
Well, now that I'm thinking about it, if it's vegetables.
That's right.
Fruits.
That's
and then as you go into the deeper bowels, that's where the junk food perhaps is, right? I've never thought about it that way.
Yeah, exactly.
Okay.
So when you go grocery shopping, stay away from the inner aisles and stay on the walls.
Oh, that's a good tip.
The inner aisles have all the foods with preservatives. In African Americans, a high intake of salt will put you at a very high risk of developing high blood pressure. So if you have these little educational tidbits, and modify your diet, exercise, and reduce your weight, you will go a long way in reducing your risk for developing both stroke and heart disease.
And obviously there is help. If you go to the doctor, there are certain medications you can put people on to help them as well, right?
That is correct. Normally, the standard practice is to try and enforce lifestyle modification. Get the patient to start to exercise if they've not started exercising. Get them to lose a little bit of weight. About 5 to 10 pounds of weight loss alone in and of itself will cut down your blood pressure significantly. And so if you did that, then that will go a long way. Now, if after aggressive lifestyle modification, you've not been able to control your risk factors, then at that point, initiation of medication is appropriate.
Now, let's talk about the death rates in Nevada here. Are they higher than other places around the country, or are we doing okay in that department with helping people?
Not necessarily. If you look at the map of the United States,
we're looking at the screen right now with the map.
That's right. You can see that in the southeastern United States, the color is a little bit more dark. Correct?
Yes. Yep.
Now, if you start from Texas, Oklahoma, Arkansas, Louisiana, Alabama, Mississippi, Tennessee, North and South Carolina, Tennessee, and some parts of Kentucky, you can see that the color shading is a little darker. That is historically referred to as the stroke belt.
Oh, okay.
That is where you find about 55% of the whole entire African American population reside in these areas. If you compare that to our Nevada map, you can see that the counties of Clark, Lander, Elko, and to the northwest, you have the color shading is also a little darker. That tells you that you have a higher concentration of African Americans and minorities in these counties. And the fact that more African Americans and women in general are predisposed to developing heart disease and stroke. That is why these maps are the way they are.
Now let's talk about the warning signs for stroke. Are they the same as men? Do we know we're having a stroke?
9 times out of 10, you know that you're having a stroke.
Okay.
Now the risk, the sudden signs of stroke, and I need people to pay very good attention to this. It's the sudden onset of numbness and confusion, word finding difficulties. So if you are sitting with somebody and all of a sudden you feel like one side of their face starts drooping, then there is something going on. If they try to move their arm, especially on one side as opposed to the other, and they can't do that, they are more than likely developing a stroke. If somebody tells you, I just had the worst headache of my life, and all of a sudden you see that their face is starting to droop, they have arm weakness, they start to get confused, it is very, very important to dial 911 right away so that we can get help to them. Because if you are able to get to help within 3 hours of onset of your symptoms, you are more than likely to recover some function. As you know, heart tissue and brain tissue are some of the tissues that are not regenerative. So if we lose it, we can't get it back.
We're almost out of time. I have 2 questions left I definitely want to ask you. Let's talk about the signs of a heart attack.
The signs of a heart attack generally is a sudden onset of chest pain. Now let me explain this. Not everybody is going to have severe chest pain. Majority of the people will describe a sudden feeling of heaviness as though an elephant was sitting on their chest, especially if that feeling is associated with a sudden cold sweat, radiation or movement of the pain to your neck, to your jaw, or to your arm. 9 times out of 10, you are having a heart attack. But it's also important in women. Women do not have the typical symptoms of a heart attack. They will more likely complain of like a sort of a gnawing feeling, epigastric discomfort, as opposed to a sudden onset of pain or discomfort.
Well, don't ignore those signs and symptoms that you might have, and go see a doctor because there is help. Thank you so much. Some great information for us this morning.
Thank you so much for having me.
Now to the end of the month, Well Health is offering free heart screenings at all of its locations. For a full list and to learn more, check out the website or call the number right there on your screen. Still to come.